Hi, I'm Rhonda MAH00079, and we will be discussing trisomy 18. The pending arrival of a new baby is always a joyous time in your life. Now imagine the baby you're carrying has a genetic disorder that can be fatal even before it's born. There are several such genetic disorders. Trisomy 18 is one of them. Today we will be discussing the meaning of trisomy 18, how it is diagnosed, and the prognosis for the baby. Let's begin with describing the meaning of trisomy 18. Trisomy 18 is an extra or a third chromosome at the number 18 spot. We each receive 23 chromosomes from each parent, for a total of 46 chromosomes. We all have 23 pairs of chromosomes. A trisomy is an extra or a third chromosome at any one spot. Most of us are familiar with Down syndrome. Down syndrome is also known as trisomy 21 because there are 3 chromosomes at the number 21 spot. Trisomy 18 is the second most common trisomy that there is. I've prepared a visual aid to help you see what a normal chromosome study looks like. This is a normal one. If the child has trisomy 18, there would be a third, like this one, at the number 18 spot. Every trisomy has its own markers or anomalies. Trisomy 18's markers or anomalies are much more severe than trisomy 21's. Next, let's discuss trisomy 18's and how it's diagnosed. The diagnosis of trisomy 18 involves several different tests. These tests include physical examination, AFP or a blood test, ultrasound, CVS or chorionic villi sampling, and amniocentesis. During your initial doctor's visit, the doctor will usually give you a physical exam. He will ask such questions as family history, if there's any history of genetic disorders in your family. Okay. According to A Healthy Me, the examination of a pregnant woman may show an unusually large uterus and extra amniotic fluid. The extra amniotic fluid is caused by the baby's inability to ingest the fluids. That's where infants or the embryos get their nutrients from, is from the amniotic fluid. With the problems that trisomy 18 babies have, they're unable to ingest that fluid. The physician will also have their patients perform an AFP test, which leads me to, as documented by trisomy 18, the triple test, also known as the AFP or quad screen, is a maternal blood screening that looks for 3 specific substances: AFP, HCG, HCG, and esterol. This is performed between the 15th and 17th week of pregnancy. In addition to these screenings, the physician will also ask you to have an ultrasound done. The ultrasound will detect anomalies or deformities. These deformities include spinal defects, heart defects, cleft palates, and clenched fists. These are just a few of the anomalies that accompany trisomy 18. If any of these tests suggest that the baby may have a genetic disorder, the doctor will then, depending on how far along you are, ask you to have additional tests. The CVS test is usually performed around 10 to 12 weeks. This test, they go in and they take a portion of the placenta, whereas the amnio is performed at 15 to 17 weeks, and they actually draw fluid from the mother, through the mother's stomach. They draw the fluid out. Both of these tests test the baby's fluids and the placenta for genetic disorders. If at this point they determine there is an extra 18 chromosome, the baby is diagnosed with trisomy 18. Now that we have the diagnosis of trisomy 18, let's discuss what it means for the baby. Trisomy 18 affects more babies in the United States than most people realize. According to the Trisomy 18 Foundation, it occurs about 1 in every 3,000 births. The numbers increase significantly when early pregnancy losses are factored in that occur in the second or third trimester of pregnancy. Almost half of the babies that make it to term are stillborn. Of those ones that are born alive, 90% of those do not make it to their first birthday. This is due to the severity of the deformities or anomalies. Okay. Helpline states the physical anomalies associated with Edwards syndrome involves nearly every organ and system of the body. Mental retardation is so severe in babies with trisomy 18 that their brains actually forget to tell their bodies to breathe. Thus, most babies have to be placed on ventilators or feeding tubes. In conclusion, most of us have never even heard of trisomy 18. For those who have had babies with trisomy 18, they need to remember there is nothing that they have done before or during or after the pregnancy that has caused this. Nature is not perfect. However, for those like myself who have had a baby with trisomy 18, it is devastating. Hopefully one day soon there will be a cure for trisomy 18 and disorders like it. Thank you for paying attention.